Every single class you take is a huge portion of what makes up, some part of physical therapy, whether it be orthopedics or, the cardiopulm classes or neuro. We have actually a lot of courses that involve a lab component. The neuro courses are a little bit different because we have actual patients that we are able to interact with, and we can practice skills on them, which is a huge advantage as opposed to just practicing on each other all day.
I knew something was wrong, and I was almost like a crazy person because they couldn't find anything. And I was 29, 30 years old, something like that.
I go to Sergeant, I go to the PhD program for the students on physical therapy.
Peter, we're going to start by having them take a history from you. Give them detailed answers, but try not to give away the type of MS that you were diagnosed with.
What was the first episode like that saw you to seek treatment?
1982, and I was skiing. And the second day, I got an earache, and I kept falling. I just couldn't stand up.
The first time I did it, it was a bit odd. I mean, it was like a pile of kids all poking me and asking me questions.
Did they put you on medications right away?
There was no medications. No, there was literally nothing.
Sometimes in class they'll show videos of patients, which is also helpful, but when you get to actually interact and ask the questions that you want to know, go all the way down. Makes it a lot more real and a lot more helpful.
My right side was what got affected.
They've just covered the subject, and now they're seeing somebody live with it.
First step to learning and figuring out where to go with a patient is learning, what they're having difficulty with.
Because of my fatigue in the past 4 weeks, I've been forgetful.
Never.
So how many times a year do you fall?
Probably 2 or 3 times a year.
He knew when to answer questions and when to try to hold the information back, so we had to get it from him.
I have a question for you guys, since you've got 2 days worth of classes on this. What's it between primary and secondary? Because I'm not sure what I have.
What do you guys think he is, secondary progressive or primary progressive?
I usually will prod them to ask important questions. I see them missing stuff.
There are probably some questions you want to ask. Do I live on a 3rd floor? Do I go out dancing frequently?
Is your bedroom on the 2nd floor?
Very helpful and willing to have students practice the same thing again and again on him, just so everyone could have, feel it and everyone who had the experience.
When you feel this, I want you to stay up. When you feel this, I want you to stay down.
Actually, I act in a way like the teacher. I help the kids. I kind of bring questions out of them. I help them sort of help diagnose me.
Somebody my age who's at this stage of it, what value would you guys bring to it? Rehab wouldn't do anything.
Your main goal is to make your walking better, and it's probably where we would at least start. And balance, too.
Well, one of the main things with MS is that there's a lot of fatigue involved. The fatigue is really limiting for them in their everyday life.
We're going to time how long it takes you to walk with your eyes closed from here to the next line. Go.
Physical therapists look for ways they can't fix it, you can't fix MS, so they look for ways to make your life better, help you get stronger, be looser, things to make your life better.
Good.
Careful, they're going to give me a bigger box.
In the case of someone like Peter, PT really comes in to help with daily function. Obviously it's progressive disease, so we're not looking to cure anything or waiting for him to get better, but as he progresses, we can help manage his day-to-day life and make things as easy for him as possible.
Yep, he gets it too, because he alternated his feet, but he used a rail. Good. All right, while we walk back in, somebody out of the floor. Perfect, 13.
I'm always so impressed at how each kid thinks of it differently and they solve the problems by themselves. So in a sense, I've learned that this disease that I have, multiple sclerosis, is sort of it's not clear, it's not black and white.